Hello, my name is Dr. Cheryce Poon Fischer.
And my name is Dr. Hannah Milch. We are breast radiologists with UCLA Health, which means we are medical doctors who specialize in using medical imaging exams to diagnose diseases of the breast. Today, we are going to talk about what it means if you get called back for more imaging after you have had a mammogram. When you arrive for your visit, we'll also talk with you about what to expect.
If you are called back after having a mammogram, it means that your radiologist wants to take a closer look at an area on your mammogram. While this can be concerning, it's important to remember that many people are called back for more testing, and most of the times the results are normal. During your callback visit, you can expect to have more imaging tests, which may include another mammogram and a breast ultrasound.
If we find a suspicious area, we may recommend a biopsy. A biopsy involves using a specialized needle to remove a small sample of breast tissue for further testing. It's important to keep in mind that a callback visit doesn't necessarily mean you have breast cancer, and it's important to follow through with any recommended tests and appointments. That way, we can make sure that any problems are caught and dealt with early.
It is crucial for us to have all past imaging of your breast so we can compare the current images to your past ones. Before your appointment, please contact us to make sure that we have any breast imaging that was done outside of UCLA Health so we can compare it with your current tests.
Please show up at least 15 minutes before your scheduled appointment, which allows time for you to fill out a form on an iPad. The visit will take about 45 to 60 minutes.
Let's take a closer look at what to expect during your visit. When you are ready for the exam, the technologist will take more images of your breast. Your radiologist will decide whether a mammogram or an ultrasound or both would be the best test for your situation. Your radiologist will then look at these new images and communicate the findings to your primary care doctor. Your test results will report findings in categories known as BI-RADS. BI-RADS Category 1 means that your test is normal and there are no signs of cancer. You would then return for a routine yearly mammogram. BI-RADS Category 2 means that there is a non-cancerous finding, such as a cyst. You would also then return for a routine yearly mammogram. BI-RADS Category 3 means that the finding is probably non-cancerous, but needs to be watched over time. You would then return for a mammogram and ultrasound test in 6 months. BI-RADS Categories 4 and 5 mean that there is a suspicious abnormality and a biopsy is recommended. It's important to note that BI-RADS Categories 4 and 5 do not necessarily mean you have breast cancer. It just means that we need a biopsy to check for problems. Your radiologist will carefully review your extra tests at the time of your appointment, and you will be given your results after your exam and before you leave the facility.
We know these tests can cause stress, and we hope to provide some comfort. Please keep in mind that most of these callback exams and biopsies are negative with no evidence of cancer. No matter the results, our doctors, nurses, technologists, and staff are here to help guide you through the process, answer your questions, and provide you with the best possible care.
We hope you found this video to be helpful. If you have any questions, please reach out to the radiology department team. Thank you so much for watching.